To provide high-quality care, healthcare workers naturally need access to highly sensitive personal data. Every day, you handle medical histories, treatment plans, and personal details. Good intentions alone do not prevent violations. In this fast-moving environment, casual, accidental breaches, a dropped chart, an unattended screen, or an overheard whisper are the most frequent threats. This is where the Health Insurance Portability and Accountability Act, or HIPAA, comes in. It is a strict national law with severe legal and financial punishments for anyone who violates patient privacy. To help you navigate this, we are going to break down a daily, step-by-step framework to manage data access, avoid disposal traps, and handle casual conversations. Proactive privacy protection is a mandatory requirement. Mastering these steps ensures the safety of your patients and protects your own career. Step 1 is mastering the need-to-know rule. Before you look at any resident's information, you must ask yourself if you actually need that specific data to perform your job. If the answer is no, stop right there. Consider a common scenario. You walk past a nurse's station and spot the name of a close friend's grandmother on the whiteboard. If she isn't under your direct care, looking at her file or going to her room is a strict legal violation. As the third bullet point on this slide outlines, simply viewing the protected health information of anyone who is not your patient breaks the law, even if you never tell a soul. Step 2 involves managing casual conversations. Verbal leaks represent the highest risk factor for accidental disclosures. You must never discuss diagnoses or patient details at a normal volume in public spaces. That includes elevators, hallways, and cafeterias. If someone else can overhear your clinical conversation, you need to lower your voice or move to a private area. You also need a protocol for external inquiries. If a neighbor asks how a resident is doing, you cannot share any details. In fact, you must politely refuse to confirm that the person is even admitted to the facility. If you accidentally overhear private health information while doing your day-to-day work, keep it entirely to yourself. You cannot repeat those details to anyone. Controlling your own internal curiosity and actively managing your conversational environment form your absolute first line of defense against data leaks. Step 3 tackles the information you are actively using across physical paper and digital screens. For digital hardware, physically angle monitors away from public view to block wandering eyes. You also need to enable 10-minute auto-lock features on your screensaver and change your system passwords every 90 days. Physical records require the exact same vigilance. Never leave patient charts or printed lab results unattended on desks or open counters where visitors could read them. Step 4 covers proper document disposal. The open trash bin is one of the most dangerous traps in any facility because no one knows who will see that paper once it leaves the building. This training slide states the rule clearly. Anything containing protected health information has to be disposed of in a way that makes the data unreadable, such as shredding. Tossing a crumpled, handwritten note with a patient's name into a personal desk-side wastebasket is a serious mistake, even if the information seems minor. If you find paper documents containing protected information, redirect them. Put them directly into a cross-cut shredder or a designated locked disposal bin until they can be destroyed. Enterprise data security does not end with the IT department. It relies on the physical habits of frontline staff managing paper and hardware. Step 5 is recognizing exactly what happens when you bypass these daily privacy steps. The legal, financial, and professional consequences are severe. As the first 2 bullet points here show, a single violation of your employer's privacy practices can lead to immediate termination and the potential loss of the professional licenses you need to work. A purposeful privacy violation faces a $50,000 fine and 1 year in jail. If it involves false pretenses, penalties hit $100,000 and 5 years. Selling data for malicious harm brings a maximum $250,000 fine and 10 years in prison. This chart illustrates the risk at the organizational level. A $50,000 individual baseline fine can leap to a massive $1.5 million annual maximum penalty for repeat corporate violations. Federal law views patient privacy as a strict mandate. Treating data casually for the sake of convenience is financially and legally devastating. While these penalties are intimidating, preventing them requires only common sense and consistent daily habits. Verify the need to know before accessing any file. Lower your voice in public areas. Shred all relevant paper, and lock your unattended screens. If you ever face an ambiguous situation regarding information sharing, this slide makes it clear. When in doubt, do not give any information out. If you discover an open trash bin violation, or if you encounter a gray area in your daily tasks, bring it to your direct supervisor or your facility's privacy official immediately. Maintaining strict confidentiality is the ultimate daily expression of your promise to provide high-quality care to your patients.